I'm Kelsey Baas, founder of Compleo, where we are passionate about taking care of the whole person and the whole family. So with me today is one of our oldest employees who's been with us from the beginning, Kay Williams, who is an incredibly experienced and gifted registered dietitian. So she works with all of our nutrition needs on staff. So Kay, why don't you tell us a little bit about what to expect if someone's preparing for a nutrition dietitian appointment? Should they have a food log? Like, kind of how should they prepare?
Okay. It kind of depends on what the person's needs are. So if someone is trying to really get healthier, they're trying to lose weight, something like that, it really is helpful to have 4 or 5 days of a food log so that I can look at it when they come in. If they don't have time to do that, I can certainly get that information, but it does speed things up a little bit. And in our assessment, which the first visit is primarily assessment, we do usually have time for some education, but I spend most of that time on assessing what the nutrition needs of the person may be. And again, depending on what the needs are, if there is a specific problem, such as gastroparesis or diabetes or some condition that pretty much the treatment is standard across the board, although somewhat individualized, of course, then those assessments usually don't take quite as long and we can get more into what that person may need. Sometimes we need a follow-up visit to give more of that information to the client or patient. So it really depends, but a food log can be very helpful. A list of medications can be very helpful. Sometimes when I get a referral, I get all of that information, and sometimes I don't.
And sometimes it's not updated. It's a really old med list.
It's very old, yes. And so bringing in a list of medications is very helpful to me because, as most people know, a lot of medications have an effect on someone's nutritional status. And so it's helpful to get that information. It's also very helpful to know kind of someone's history, their weight history, for example. And so I get all of that information as well. So diet history, meds, what all of their diagnoses are, because sometimes they have several different needs. Perhaps they have 3 or 4 conditions. And so that presents, different information that's needed for that person. So it does depend, but generally speaking, we're doing an assessment that first visit with a little bit of time of explanation and education. If I know ahead of time that someone has a condition such as gastroparesis, I'm going to use that for an example because I've seen quite a bit of that lately.
Yeah, we've had a lot of that has come through.
So if that is the diagnosis, I know what that person needs to do to work with that condition as far as their nutrition. So that's pretty cut and dry usually. But there are other conditions that aren't as cut and dry, various digestive issues that we're not really sure why they're having these issues. And so there's a lot of assessment that takes place in those appointments. So it does depend.
Yeah. And then in terms of follow-up appointments, is it best for people to come? Y'all usually come up with a few things to try.
Right.
So how long does it take for diet changes, if it's going to help improve your condition, to take effect? So should people follow up 1 week after evals, or should they come back once a month? I know it depends is our favorite answer at the clinic because we individualize things a lot. Yes. But kind of just general when people are trying to plan for what to expect after that intake, how often or how far apart should the visits be?
Okay, that's a good question. If a person tells me I need accountability, then it's usually about every other week. Okay. If a person tells me I don't have insurance, I can't come that often, then we might do once a month.
Yeah.
So yes, it depends. But generally speaking, about every 2 weeks if we're doing regular follow-up.
Perfect. Yeah. And some people just want the education for their medical condition, that's all they need.
That's right.
And then other people do want the accountability. So what are some of the most common, you said we've seen a lot of gastroparesis. Of course, a lot of people who are looking for either weight management, whether that's gaining weight, losing weight, we always like to focus on other goals,
Mhm.
energy, sleep,
Mhm.
intuitive eating type things. What are some of the other areas that you focus on?
Okay. So in the assessment?
Oh,
Or
just like diagnostics,
just
like
like
pregnancy,
gotcha.
menopause,
Okay.
kind of, what are
Yeah.
some other areas
Okay.
that you treat?
So I do treat some
Mhm.
eating disorders. We have another dietitian that also does that.
Right.
So I don't do as many of those now, but I can. And that would be the exception of they may need follow up every week,
Right.
particularly if they're very low in weight.
Mhm.
So that is one of the exceptions where we would see them every week. And I do have a few
Yeah.
of those. Okay. But I also see, in addition to all kinds of gastroenterology type problems, which
Yeah.
I've had quite a bit of lately, a lot of IBS, inflammatory bowel disease, gastroparesis, reflux, that people sometimes will have trouble keeping under control. So I'll see those.
Yeah.
Those are very common. I see some diabetes and some pre-diabetes. Of course, I see weight management. I see some that struggle to gain weight. I've had a couple of those this month. And so we've worked on that. So a wide range of things. Some of my favorite things right now, and it seems to change. But I do love talking about fertility. I think people don't realize how nutrition can really affect their fertility and the quality of the egg and sperm. And so a lot of times those visits are for the male and the female, the mom and the dad. So I will do that, and I enjoy that.
That helped us a ton. I don't know if it was you or not, but we got pregnant
right.
pretty soon after you started helping us with our nutrition. So fertility nutrition, I think, is a great area for people to work on.
Yes. And then, of course, we have a dietitian that works with breastfeeding and works with moms. And so I don't do a lot of that. I really enjoy working with parents on picky eating because I'm very passionate about children having a healthy relationship with food. And it really starts with the parents, first of all, having a healthy relationship with food themselves, but also how they work with that child so that that child does not feel shame about what they eat. They don't feel any embarrassment, whether it's because they're picky or they're eating a little too much, perhaps more than they need. Whatever the case may be, that's a very passionate area for me. Lately, as I was telling you earlier, I've become very interested in menopause because up until the last 10 years or so, most of the research on people in their 40s, 50s, and 60s were done on men, and they weren't done on women. And so now that we have some researchers that are very interested in women, we now know, as one researcher says, women are not little men. We have specific needs.
We have our own needs. Yes.
We have our own needs. We have different hormones at different levels. There are so many more things that affect our nutrition and our eating. And, I'll have these women come to me and they'll say, listen, I haven't gained any weight, but my weight it's totally changed where it is. Well, there's a reason for that. And there are some things nutritionally that you can do to fight that. And so I think, knowledge is power, of course. So if we can give women this knowledge, and if they're motivated to make some changes, they can really change a lot of the things that they don't like about menopause.
I had no idea. I'm so glad that research is coming out. I mean, I think we're seeing that across the health spectrum, that women have been a little neglected in the research and in every area. I'm glad we're catching up. So I'm excited that we can start offering those services.
Yeah.
So if you are interested in any of these areas or have any additional questions, reach out to us at Compleo and Kay or any of our other dietitians. We'd love to help you out.